In this video, we'll discuss about laundry management. Laundry management for biomedical waste is a critical process. It is a critical process that ensures the safe handling and disposal of contaminated textiles. This method ensures safe handling and disposal of contaminated textiles used in healthcare facilities. So, laundry management for biomedical waste is a critical process that ensures the safe handling and disposal of contaminated textile used in healthcare facilities. Proper management of biomedical waste is crucial to prevent the spread of infection and protect the environment. Proper management of biomedical waste is crucial. It is important. Why? Prevent spread of infection and protect our environment. Here we want to discuss some key points to consider laundry management for biomedical waste. Here we want to discuss some key points. First key point, segregation. Segregate biomedical waste from other type of waste. So we want to segregate biomedical waste from other type of waste at the point of generation. Place contaminated textiles such as scrubs, lab coat, linen in designed bin or bags labeled for specifically labeled for biomedical waste. So here segregation of biomedical waste at other type of waste at the point of generation. Here we can use specifically designed pin or bags. Next, color coding. Here use color coded bags or container, white color, blue color, yellow color, like that. Use color coded bags container to differentiate different type of biomedical waste. A different color represent different categories of waste such as infectious waste, sharp waste and or non-infectious waste. By using coloring we can identify it. Consult local regulation or guidelines for specific color coding requirement. So here we want to consult local hospital guidelines for specific color coding requirement. Third key factors, containment. Containment ensure that contaminated textiles are securely contained to prevent leakage or contamination during storage, handling and transportation. Containment ensure that contaminated textiles are securely contained to prevent leakage. This one, to prevent leakage during storage, handling and transportation. So we can use container designed for biomedical waste, leak proof bags. Leak proof bags or container designed for biomedical waste and seal them properly. Next, storage. Store biomedical waste in a dedicated area that is secure, well ventilated. We can storage of biomedical waste in a dedicated area that is secure, well ventilated and inaccessible to unauthorized personnel. The storage area have appropriate temperature, humidity control to prevent the growth of microorganisms and important things, minimize the odor. So storage area have appropriate temperature and humidity. This one will prevent growth of microorganism and minimize odors. Next, key factors: transportation. Follow local regulation and guidelines for transporting biomedical waste. We can follow local hospital guidelines for transporting biomedical waste. Use authorized and licensed waste management companies. So here we can use authorized and licensed waste management companies or facilities for transportation to ensure compliance with safety standards. Fifth factor, transportation. Sixth one, treatment. Biomedical waste textiles should be treated before being sent to laundry. Before sending laundry, we will give treatment. Treatment method may include autoclaving method or incineration method or chemical disinfectant method depending on the local regulation and the specific type of waste. Treatment before sending laundry, we will do treatment. It may be autoclaving or incineration or chemical disinfectant method depending on local regulation, okay, based on the hospital and type of waste. Next key factor, laundry process. After the treatment, the contaminated textiles can be safely laundered. It is essential for follow proper laundering procedure, include the use of appropriate detergent, water, temperature. So laundry process essential for proper laundering, including uses of appropriate detergent, water, temperature and disinfectant to ensure through cleaning and decontamination. So here we can use detergent, water, temperature and disinfectant to ensure through cleaning and decontamination. Follow the manufacturer instruction for laundering the specific type of textile. Based on the textile, we can follow that manufacturer instruction. Next factor, monitoring and documentation. Monitoring and documentation. Maintain record of the laundry process, including the data, time and details of that process. Okay, here we want to maintain the record. It included data, time and detail of that process. Regulatory monitor the laundering equipment for proper functioning and calibration. Regularly we will monitor that laundering equipment for proper functioning and calibration. Document any incident or deviation from standard procedure and take appropriate corrective actions. So monitoring and document. In this one we want to maintaining record the laundry process data, time and detail. Then regular monitor that laundry equipment whether it can work or not, proper functioning and calibration. Then document any incident or deviation from standard procedure. Any deviation means we want to make document. Take appropriate corrective action. Then stop training. Provide comprehensive training to laundry staff. So we can provide comprehensive training for laundry staff regarding and disposal of biomedical waste textiles. So we provided training for laundry staff recording and disposal of biomedical waste textile. Ensure that they are aware of safety protocols, infection control measure and regulatory equipment. Aware of safety protocols, they have the awareness of that safety protocols, infection control measure and regulatory requirement. complication and regulation, stay up to date with local, state, and national regulation governing biomedical waste. Regulation, complaints and regulation, stay up to date with the local, state, and national regulation governing biomedical waste. Adhere to all applicable guidelines and requirements to ensure legal compliance and maintain a safe environment. It is important to note that specific guidelines and regulation may vary depending on the country and region. It is crucial to consult local authorities, waste management agencies, and healthcare regulatory bodies to ensure compliance with the most current and relevant guidelines. So, all applicable guidance and requirement to ensure legal compliance and maintain a safe environment. Important to note that specific guidelines and regulation it vary from country to country, region to region. It is crucial to consult local authorities, waste management agencies, then healthcare regulator bodies to ensure compliance with the most current and relevant guidance. Thanks for watching.